Hello friends, welcome to my YouTube channel. Today we're going to learn the Norma lateralis. Norma lateralis is the lateral aspect of the skull. First starts with the bones seen on Norma lateralis. We can see here is a temporal bone, here is a parietal bone. We can see the part of frontal bone, zygomatic bone. So here we have the greater wing of sphenoid, part of occipital bone, and we can see the maxilla. Now what are the features on this norma lateralis? On the norma lateralis we can see there are two temporal lines, superior temporal line and inferior temporal line, and these two temporal lines originates from the frontal process of the zygomatic bone. So this is a zygomatic bone. Zygomatic bone has got a process which is going towards the frontal bone. This is called frontal process of zygomatic bone. Okay, so the temporal line starts from here. The first one is we have the superior temporal. I'm just marking the superior temporal line. So this is we have the superior temporal line arises from here. It runs upwards and backwards, and fades behind. Okay, just below that there is inferior temporal line, again starts from the same point. It runs parallel to the superior temporal line, then it runs downwards, backwards and forwards, and meets at the root of zygomatic process. This is a zygomatic process. We will see the zygomatic process later in detail. The inferior temporal line starts from this particular point, that is the frontal process of the zygomatic bone, and ends at the root of zygomatic process. Okay, and this inferior temporal line gives attachment to, there is a muscle that is known as a temporalis muscle, and the temporalis muscle is covered by a fascia called temporal fascia. The temporal fascia is attached onto this superior temporal line. The norma lateralis is divided into two areas by the zygomatic arch, area above and area below. The area above is known as temporal fossa and area below is known as infratemporal fossa. So here we have the infratemporal fossa and this is a temporal fossa. Zygomatic arch is a bar of bone which is formed by two bones. One is anteriorly it gets contribution from the zygomatic bone, and posteriorly gets its contribution from the temporal bone. Okay, the temporal bone has got a process which goes towards the zygomatic bone. This is known as the zygomatic process of temporal bone. Zygomatic process of temporal bone, and the process of the zygomatic bone which goes towards the temporal bone is known as the temporal process of zygomatic bone. And zygomatic arch got two surface, external surface, internal surface, two borders, superior border and inferior border. Okay, and the superior border of this particular zygomatic arch, the outer surface of the zygomatic arch is subcutaneous, and it is related to three structures. One is auriculotemporal nerve, superficial temporal artery and superficial temporal vein. Inner surface and the lower border gives attachment to masseter muscle, and the upper border gives attachment to temporal fascia. I told you temporal fascia takes origin from the superior temporal line and it ends at the superior border of then. Again, if you see the posterior end of the zygomatic arch, ends at a tubercle, and this tubercle is known as a root of zygoma. You can see clearly tubercle of root of zygoma. From the tubercle of root of zygoma, there arises two borders. One is anterior root. From the root of zygoma, there arises two borders. This border is known as the anterior root, and this one is known as the posterior root. This is the posterior root. This posterior root is known as the supramastoid crest. Whereas this anterior border is known as the articular tubercle. External auditory meatus is located behind the mandibular fossa. If we see here, before that, there is a fossa. This fossa is known as a mandibular fossa, where the mandible is articulated to form the temporomandibular joint. Temporomandibular joint. I'm just articulating. I will show you. So here I'm having the mandible. See, the mandible is articulated over here. Mandible is articulated over here, forms the temporomandibular joint. I told you, root of zygoma and the anterior border is known as the articular tubercle. Okay, this articular tubercle prevents the anterior dislocation of the mandible during the wide opening of the mouth. You know, here, posterior and the floor of this external auditory meatus is formed by tympanic plate. This particular part is known as the tympanic plate, whereas the superior aspect and the posto-superior margin, superior as well as the posto-superior margin is formed by the palmar part of temporal bone. The margin gives attachment to the cartilaginous part of external acoustic meatus. External acoustic meatus. Now I'm going to tell you a very important landmark. Just look at this area. You know, external auditory meatus over here. Okay, you know, already I told you there is a crust that is known as the supramastoid crust. This crust is known as the supramastoid crust. We have the mastoid process. Above the mastoid process, we have the supramastoid crust. Okay, so just identify the supramastoid crust, and we have the posto-superior aspect of the external auditory meatus. If we have the external auditory meatus, posto-superior margin. Okay, I'm just marking over. Just see, this is the supramastoid crust, and here we have the posto-superior aspect of the external auditory meatus, and make another tangent here. Just make a tangent over here, and you are getting a triangular area. This triangular area, and this triangular area is known as the suprameatal triangle or McEwen's triangle. Remember, suprameatal triangle or the McEwen's triangle. It has got some surgical importance. You know, here we have the mastoid bone. Inside the mastoid bone, there are mastoid air cells are there. This is called mastoid antrum. Middle ear infection or may infect the mastoid air cells, leads to mastoiditis. The mastoiditis can be drained through this McEwen's triangle. Okay, almost 12.5 millimeter deep to this McEwen's triangle, there lies the mastoid antrum, and the mastoid antrum can be drained through this McEwen's triangle. Next, you can see the mastoid process. Okay, the mastoid process is a downward projection from the temporal bone, downward projection from the mastoid part of the temporal bone. There are two muscles attached to this mastoid process. The external surface of this mastoid process, you know, which muscle is attached? We have the sternocleidomastoid muscle, whereas the inner aspect gives attachment to the or gives origin to posterior belly of digastric. And if we see here, the medial aspect of the mastoid process, there is a sulcus, okay, through which the occipital artery passes. You know, okay. Another feature we can see here is the styloid process. This is now, if we examine the temporal fossa, there is a specialized area where four bones meets. So that particular area is known as the pterion. I'm just marking the pterion here. This circular area is known as pterion. Let us see what are the bones meets at the pterion. So we have the squamous part of temporal bone, parietal bone, frontal bone, and greater wing of sphenoid. So these four bones meets by an H-shaped suture. So here you can see there is an H-shaped suture. So this pterion is situated about 4 cm above the zygomatic arch and 3.5 cm behind the frontozygomatic suture. Here we have the frontozygomatic suture, 3.5 cm behind the frontozygomatic suture and 4 cm above the zygomatic arch. We can locate the pterion. What are the importance of the pterion? Deep to the pterion, inside the cranial cavity, there is an important blood vessel is running, that is known as the middle meningeal artery. And one more important structure is present, that is known as the stem of lateral sulcus. These two important structures are situated deep to this pterion. And any injury or trauma to this pterion which affects these structures. Trauma to this area leads to the rupture of middle meningeal artery and leads to extradural hemorrhage. Remember this point.